Anatomy of stomach. This is the stomach bed diagram, and the stomach is a muscular bag which forms the widest and the most distensible part of the digestive tube. The stomach is continuous above with the lower end of the esophagus, and it is continuous below to the duodenum. It acts as a reservoir of food. The stomach is located in the epigastric, umbilical, and left hypochondriac regions. The shape of stomach varies in all the individuals. In normal active persons, the stomach is sthenic, which means it is J-shaped. In thin tall persons, the stomach is hyposthenic, which means it is J-shaped. But it is in broad, strong, very active persons, it is horizontal in shape. In obese persons also, it is horizontal in shape. And the shape of stomach can be studied by obtaining barium meal radiograph. The stomach is a very distensible organ, so the size and capacity of the stomach is also more. So the size of stomach is 25 centimeters long. The mean capacity of stomach is 30 ml at birth, and the capacity of stomach increases to 1000 ml at puberty, and in adults it becomes 1.5 to 2 liters. External features of stomach. The stomach has 2 orifices, 2 curvatures, 2 surfaces, 2 parts. The 2 orifices are cardiac orifice, pyloric orifice. The 2 curvatures are lesser curvature and greater curvature. The 2 surfaces are anterior and posterior surfaces. The 2 parts are cardiac part and pyloric part. So first there are 2 orifices, cardiac orifice and pyloric orifice. Cardiac orifice is the junction of lower end of esophagus with the stomach. And the cardiac orifice is behind the left. It is behind the left 7th costal cartilage, 2.5 centimeters away from sternum at the level of T11. And pyloric orifice, next orifice is the pyloric orifice. This opens to duodenum. And cardiac orifice is the opening of esophagus into stomach. Pyloric orifice is the opening of stomach into duodenum. In empty stomach and in supine position, pyloric orifice lies 1.2 centimeter to the right of median plane at the level of L1, which is the transpyloric plane. The pyloric constriction is produced by the pyloric sphincter, which is present underneath the pyloric orifice, and the prepyloric vein of Mayo also is useful in indicating the surface of stomach, indicating the position of pyloric orifice on the surface of the stomach. And there are 2 curvatures of the stomach, lesser curvature and greater curvature. Lesser curvature is concave, greater curvature is convex. Lesser curvature forms right border of the stomach. Greater curvature forms the left border of the stomach. Lesser curvature provides attachment to lesser omentum, and greater curvature provides attachment to greater omentum. And the most dependent part on the lesser curvature is the angular notch or the incisura angularis. The greater curvature provides attachment to greater omentum, gastrosplenic ligament and gastrophrenic ligament. And the greater curvature has cardiac notch at its upper end, and this cardiac notch separates the stomach from esophagus. The greater curvature is 5 times longer than the lesser curvature, and there are 2 surfaces in the stomach, anterior surface and posterior surface. Anterior surface is facing forwards, and posterior surface will face backwards. The stomach is divided into 2 parts, cardiac part and pyloric part. And how are these 2 parts divided? The angular notch, incisor angularis, which is present in the lesser curvature, an imaginary line drawn from angula incisaris from lesser curvature to the greater curvature. This line divides the stomach into two parts, cardiac part and the pyloric part. Cardiac part is the large part which is further subdivided to fundus and body. The pyloric part is the small part which is further subdivided to pyloric antrum and pyloric canal. So the large cardiac part is subdivided to fundus and body. The fundus of the stomach is the upper convex dome shaped part. Body is the part of stomach which lies between the fundus and the pyloric antrum. And the fundus of stomach is distended with gas seen under the X-ray under the left dome of diaphragm. The body of the stomach is between the fundus and pyloric antrum. The body can be distended enormously along the greater curvature. The gastric glands are present in the fundus and the body of the stomach, and these gastric glands secrete the gastric glands contain three types of secretory cells, namely mucus cells, chief cells, parietal cells. And this is all about cardiac part. And the pyloric part is the small part which is again subdivided to pyloric antrum and pyloric canal. The pyloric antrum is separated from the pyloric canal by sulcus intermedius, which is an inconstant sulcus present in greater curvature. The pyloric antrum is 7.5 centimeters long and pyloric canal is 2.5 centimeters long. The pyloric antrum contains pyloric glands which are richest in mucus glands. The pyloric canal is narrow and tubular, and it terminates at the pylorus in its right end. And regarding the relations of stomach, first peritoneal relations. The stomach is lined by peritoneum on both its anterior surface as well as its posterior surface. And in the lesser curvature, the peritoneum on the anterior surface and posterior surface meet at the lesser curvature, and they become continuous with the lesser omentum. And along the greater curvature, these two layers meet to form the greater omentum. Near the fundus, the two layers meet to form gastrosplenic ligament. So gastrosplenic ligament is near the fundus of the stomach. Gastrophrenic ligament is near the cardiac end, and cranial to the gastrophrenic ligament, which means above the gastrophrenic ligament, small part of the posterior surface of stomach will be in direct contact with the diaphragm without peritoneum. So that area is called as the bare area of the stomach. The greater and lesser curvatures along the peritoneal reflections are also bare. And regarding the visceral relations, anterior surface of stomach is related to three structures: liver, diaphragm, and anterior abdominal wall. The diaphragm separates the stomach from left pleura, pericardium, and 6th to 9th ribs. Costal cartilages are separated from the stomach by transversus abdominis muscles. And there is a space called Trabes space, Traube, Trabes space. It is the space between left costal margin and lower edge of the left lung on the stomach. On percussion, there is a resonant note over the Trabes space, but in splenomegaly or in pleural effusion, there will be a dull note. So this diagram represents the stomach bed structures. Stomach bed structures means the structures which are related to the posterior surface of the stomach, and these structures are diaphragm, the diaphragm, and left kidney, this is the left kidney, then left suprarenal gland, and pancreas, this is the pancreas, then transverse mesocolon, this is the transverse mesocolon, splenic flexure of colon, this is the splenic flexure of colon, then splenic artery, this is the splenic artery. It traverses from stomach and reaches the spleen. It is tortuous in course. The splenic artery is tortuous in course. This is the splenic artery. The red color is the splenic artery. So these are the stomach bed structures. So all these stomach bed structures are separated from the stomach by the cavity of lesser sac. And sometimes in stomach bed structure, spleen is also included. Then blood supply of the stomach in lesser curvature, left gastric artery, greater curvature, right gastroepiploic artery. The left gastric artery is a branch of celiac trunk. The lesser curvature. Along the lesser curvature, stomach is supplied by left gastric artery and right gastric artery. So left gastric artery is a branch of celiac trunk and right gastric artery is a branch of proper hepatic artery. Along the greater curvature, stomach is supplied by right gastroepiploic artery and left gastroepiploic artery. The right gastroepiploic artery is a branch of gastroduodenal artery and left gastroepiploic artery is a branch of splenic artery. And the fundus of stomach is supplied by 5 to 7 short gastric arteries, which are branches of splenic artery. Venous drainage of the stomach is portal, superior mesenteric, and finally to splenic veins. And right and left gastric veins, right and left gastroepiploic veins, short gastric veins, they are also the veins of the stomach. So regarding the lymphatic drainage of the stomach, there are 4 areas of the stomach. Area A, B, C, D. Area A drains to pancreaticosplenic lymph nodes. Area A is the upper part of the left 1/3. Area B is the right 2/3 part. Area C is the lower part of the left 1/3. Upper part of left 1/3 is area A. Lower part of left 1/3 is area C. Area B is the right 2/3 part. Area D is the pyloric part. So area A, which is the upper left 1/3 part, drains to pancreaticosplenic nodes. Then area B, that is right 2/3 part, drains to left gastric nodes. Area C, that is lower part of lower left 1/3 part, drains to right gastroepiploic nodes, then subpyloric nodes, then hepatic nodes. So area C first drains to right gastroepiploic, subpyloric, and hepatic. Area D, that is the pyloric part, they drain different directions to pyloric nodes, hepatic nodes, left gastric nodes. So from all these areas, area A, B, C, D, all these lymph nodes finally drain to celiac nodes, celiac lymph nodes. So from the celiac nodes, they pass through intestinal lymph trunk and then they reach the cisterna chyli. So this is about the lymphatic drainage of stomach. Nerve supply of stomach. The stomach is supplied by both sympathetic nerves and parasympathetic nerves. Sympathetic nerves are T6 to T10 segments of the spinal cord. Parasympathetic nerves are derived from vagus through esophageal plexus and gastric nerves. The anterior gastric nerve, posterior gastric nerve. Anterior gastric nerve contains left vagal fibers. Posterior gastric nerve contains right vagal fibers. which further anterior and posterior gastric nerves further divide to many branches. The interior of the stomach has four layers: mucosa, submucosa, muscular coat, serous coat. Mucosa of the empty stomach is thrown into folds called as gastric rugae. Gastric pits are also present, and the part of the lumen of stomach along the lesser curvature is called as gastric canal or Magen's trace. And this is all about mucosa of the stomach. The submucosa is made up of connective tissue, arterioles and nerve plexus. The muscular coat layer, it is of three layers: longitudinal muscle fiber, longitudinal muscle layer, and inner circular layer. And finally serous coat, which consists peritoneal coverings. And functions of stomach, main function is it acts as reservoir of food, and it helps in digestion. It produces gastric juice which help in digestion, and they produce mucus. The lining cells of the stomach produce mucus, so it that mucus will protect the stomach from corrosive action of HCl. And the stomach produces intrinsic factor of Castle which helps in vitamin B12 absorption. And regarding the applied anatomy of stomach, the gastric pain is felt in epigastrium because the sympathetic nerve supply of stomach is T6 to T9 segments of the spinal cord, which also supply anterior abdominal wall. So gastric pain is felt in the epigastrium. So how is the gastric pain produced? It is produced either by spasm of muscle or by over distension. And then peptic ulcer and gastric ulcer. The gastric ulcer is common along the lesser curvature. Peptic ulcer is common along the greater curvature. And gastric carcinoma occurs along greater curvature. Gastric ulcer is along the lesser curvature. Gastric carcinoma is along the greater curvature. So in the greater curvature, gastric carcinoma occurs, and the metastasis from gastric carcinoma can occur through thoracic duct to the left supraclavicular lymph node. This is called as Troisius sign, and these lymph nodes are called as signal nodes. And this gastric carcinoma is common in people with blood group A. And pyloric obstruction, the pyloric obstruction can be congenital or acquired, and it causes peristalsis in epigastrium and vomiting after meals. Visible peristalsis in the epigastrium and vomiting after meals is due to pyloric obstruction. And hyposthenic stomach. People with hyposthenic stomach. Hyposthenic means those who have a long and narrow stomach, they are more prone for gastric ulcer. Hypersthenic stomach people are more prone for duodenal ulcer. Hyposthenic means long and narrow. Hypersthenic means short and broad. So hyposthenic stomach more prone for gastric ulcer. Hypersthenic stomach is more prone for duodenal ulcer.